So, this is a little bit about who we are at IFG at the International Fertility Group. You will be able to see that at IFG, we're not just another fertility provider. So it's important to know that, yes, we are pioneers in mitochondrial replacement therapy. We are not the first, but we are pioneers in bringing it to the human population. Okay. So we do have unrivaled medical experience. We are science driven. So it's really important to note that. And then we also adhere to globally recognized standards of safety. Moreover, it's really important for us that we give you individualized care. I can speak to the United States as that's my experience, but here we often offer sort of cookie cutter solutions to the majority of people and then standardize from there. At the International Fertility Group, we're going to customize your treatment based on your own parameters and your own testing results. Okay. So, who considers mitochondrial replacement therapy for family building? It's usually women in one of three categories. Okay. So either women are carriers of mitochondrial disease, because if the child is affected, he or she, it could be fatal for the child. Um, Also for women that experience recurrent pregnancy loss due to low embryo implantation. And lastly, women of advanced maternal age, me included, experiencing low oocyte viability. Okay, those are the basic categories. Now, we offer mitochondrial replacement therapy in one of two ways. There are two techniques, and I'm simply going to go over them so you have a better sense for how this works. So, while it's called mitochondrial replacement, we are actually moving the nucleus and not the mitochondria itself. So, if you look at maternal spindle transfer, this is happening prior to fertilization of the egg. So we'll have a donor egg. We do need a donor egg because we do need the healthy mitochondria. And then we would have a patient egg. So depending on where she is in one of those three categories, she would have what is deemed abnormal mitochondria. Maybe it's aging and it doesn't have the same power as it once did, but the mitochondria are known as the powerhouse of a cell. So it's really important that they have a lot of energy to power that cell to reproduce. So if you look at this, you will see that we'll remove the nucleus from the donor cytoplasm. And what are we going to do with the nucleus? We're going to discard it. Why? Because it's the donor's DNA. The nucleus contains about 99% of your DNA. So your hair color, your eye color, your skin tone, all of that is housed in your nucleus and in your nuclear DNA. And we're going to do the same with your egg, and we're going to remove the nucleus from your egg and retain that one to move it into the donor cytoplasm using her healthy mitochondria to then power that cell to reproduce once it is fertilized with sperm. Okay, so that's the maternal spindle transfers. It happens pre-fertilization. It's important to note that eggs are delicate, right? Eggs or oocytes are delicate. And so we can sometimes experience some attrition between the freeze and thaw, right? We could lose some of the eggs. And then also they're really delicate when we go to micromanipulate them. So I'm going to show you an example in just a moment, but first I'm going to talk about the next technique. And that next technique is the pronuclear transfer. Okay, so the pronuclear transfer happens after fertilization. So you'll see that right here from the start, we're going to fertilize both the donor egg as well as the patient's egg or the maternal egg. From there, we're going to remove the pronuclei. So it's now a pronuclei because it's already been fertilized. And we're going to discard the one from the donor. And we're going to retain the one from the mother and again move it over into the donor cytoplasm using her healthy mitochondria to power that cell to reproduce and to grow into a healthy embryo and then ideally a healthy blastocyst and grow from there once it's implanted in the uterine lining. The pronuclear transfer is slightly preferred, so we do that about 60%, and that would be useful to know for women who, for example, have difficulties fertilizing their eggs. you might consider the maternal spindle first. If you have no problems with fertilizing your eggs, pronuclear would certainly be preferred. And the reason is because a membrane, if you once you've created that early embryo, which is known as a zygote, it's essentially a day one embryo. It has a membrane around it, creating a sturdier structure. So if you think of that micromanipulation with the puncturing it with a needle, right? It would create that sturdier structure to maintain that cell from being destroyed, whereas the oocytes or the eggs do not have that, so they could be a little bit more delicate. So this is a sort of gross example of how that looks. So you might use a soap bubble to indicate an egg or an oocyte, and it sort of just disintegrates or it pops, right, when you try to puncture it. However, an orange has that sturdier structure and it's not going anywhere. It also survives the freeze thaw process much better than the eggs do. Okay. But again, we do both micro manipulation of both the egg and the zygote almost equally. That being said, these are our experts. So it's important to note that Dr. Uliana is not just an OBGYN. She's also not just a reproductive endocrinologist in infertility, but she holds a patent on folliculogenesis activation for women of advanced maternal age. Okay. She also completed a PhD in 2023 on optimizing oocyte quality in older patients. So, for those of you on the call who are like me of advanced maternal age, Dr. Uliana is the expert and can guide us. I want to also be clear that Dr. Barol is our lead embryologist, okay? He is the only person whose hand performs the MRT process, okay? And the reason is I think of this example. Maybe you have someone in your family who had an amazing dish that was your favorite dish, and that person gave you that recipe, and you've been trying to replicate it all these years, and you haven't been successful. Maybe it's an extra ingredient that wasn't listed on the recipe itself, or maybe it was just that love that went into it, and it just you don't remember it tasting the same. You can give an instruction manual for how to perform the mitochondrial replacement therapy to any embryologist. And unless you have that trained precision in your hand and you know exactly how to do it and to simply remove the nucleus without the aging mitochondria, you face risks such as heteroplasmy, right? So it's important that the person who's performing your mitochondrial replacement therapy be the best. So I can tell you that Dr. Barol is amazing. I actually witnessed him perform this procedure in December. He has gone through essentially 7,000 bovine or cow eggs, as well as 2,000 human donor eggs in order to perfect his procedure. Okay, so he is not a novice by any stretch of the word. And we have had over 80 transfers with 32 births. And additionally, Dr. Barol has been doing this longer than IFG has been in existence. The oldest child that was created by his hand is now 7 going on 8 and resides in China. Okay, and has been incredibly healthy. So it's important that you choose the right person to do this for you. Now, we cannot perform MRT in the United States or in the majority of places of the world. Why? Because it is not permitted. MRT is permitted in the United Kingdom as well as in Australia, but only in the cases of being a carrier for mitochondrial disease. Not in any other cases, not of advanced maternal age, recurrent pregnancy loss. Okay, so we are working with all three categories, and specifically in Albania. I don't know about you, but when I heard the country of Albania, I was like, where is that exactly? And I have a sense for the world. But once I found out it was right across from Italy, right? And it's right above Greece, I had a really good sense of where it was. So Albania is a beautiful country. It has mountains, it has sea. It's lovely. And also it's quite affordable. So those who go there from anywhere hopefully will extend and be able to make a vacation of it as well. But we are partnered with STEM and Gene, which is the clinic in Tirana, which is the capital city of Albania. It is in a safe, vibrant, and new, because there are lots of new developments going up. And so the neighborhood is really up and coming. They really focus on reproductive medicine, cutting edge laboratory facilities, and they offer exceptional patient care. So it's important to know a little bit about what the clinic looks like. And again, I can speak to it firsthand since I was just there in December. It is absolutely beautiful. So let's talk about the mitochondrial replacement therapy programs. And if you have any pressing questions, I promise I will get to them. I'm sure there are a lot of questions. We started out with the full mitochondrial replacement therapy program, which is, and I'm going to quote you in dollars. Certainly, if any are on the call and you need euros, we also have pricing in euros. I have the dollars because I'm primarily working in the US market. So the full MRT program for 4 to 15 eggs or zygotes is $20,000. We were asked to create a mini program because some women really have a tough time with the stimulation and stimulation medications in their body, and maybe they were only able to produce one egg per retrieval. So we created this mini MRT program for 1 to 4, and that cost us $16,000. Now, the caveat is this. It often takes, we're finding that the ratio is 4 eggs or zygotes to one good quality euploid. So you could pay the $16,000 for a mini program and potentially wind up with 0 euploids because we cannot offer a guarantee, 1 euploid or more. It's just too hard to know. Everybody is different. There are many different diagnoses going on. In addition to the infertility diagnosis, perhaps somebody has endometriosis, right? There's all of these other things going on that could also affect as things progress. And certainly I'm talking more about the transfer than the embryo creation in that particular example. What is included in both programs is 1 egg retrieval in Albania and 1 embryo transfer in Albania. Okay. It's also important to note that there are also elements that are not included. And one of those elements is the cost of donor eggs. So the cost of donor eggs is $550 per egg. People might say, why haven't you just included the eggs in the price? And the answer is there's such a sliding scale of need when it comes to this. So it wouldn't make sense for us to charge you for 10 donor eggs if you only need 3. And also, it wouldn't be fiscally responsible of us to charge you for 10 donor eggs if you need 18. So that being said, we use as many as you need, and we charge you for the usage for each individual egg. Lastly, the other piece is right now we are requiring PGT testing with our MRT program. The cost of one PGT tested embryo is $540. Okay. And again, it's the same thing. We don't know how many embryos you're going to be able to create in order to be able to include that in our package. So it is a separate cost. Okay. So for those who have questions about how this would work, I'm going to show you the hypothetical scenarios that I've thought of. Certainly, you may think of others, and I would love to hear them if I'm missing something. So, if you were to choose to undergo MRT with us, you might consider option number 1, which is to take full advantage of your program. Okay. So you may retrieve at your local clinic. Perhaps you're going to need more retrievals in order to accumulate enough eggs to be able to proceed with the MRT. And again, I say eggs as eggs or zygotes, right? As implied. But you would retrieve potentially at your local clinic. For some people, it depends on cost. And then you could potentially freeze and ship your eggs or zygotes as well as sperm to Albania, to the clinic there. You would then travel to Albania twice, again, to take full advantage of your package. So once for the retrieval, the final retrieval that's actually included in your package, and a second time for the embryo transfer. Okay. Option number two is for those who simply do not have the time. We are busy women. We balance a lot of things simultaneously, and sometimes we simply cannot get away. So for those women who really would find it difficult to go to Albania twice, you could do all of your egg retrievals and or zygote creation in your local clinic, whether that's in the United States, Canada, the United Kingdom, Germany, anywhere throughout the world. And then you could choose to forego or skip the egg retrieval that is included in your package. There is no change in cost, unfortunately, but whether you choose to skip that is entirely your prerogative or your choice. Then you would only travel once to Albania for your embryo transfer. Lastly, for those who perhaps reside in the United States, we know that the cost of one cycle could potentially be $15,000 to $20,000 if you don't have insurance. The cost in the UK, I'm sure, is astronomical and quite similar. You may choose to travel to Albania for all of your cycles. Okay. If you choose to travel there for a cumulative cycle or an egg banking cycle, I can quote you that it's 3,150 US dollars for one cycle. That does not include the cost of medications, which is approximately 1,500 per cycle. So again, it would be weighing the cost of maybe $5,000 per cycle versus $15,000 to $20,000 per cycle. So if cost is of import to you, you might consider this option. And again, it might be worth going through multiple egg retrieval cycles so that you're only paying once for the MRT procedure, okay, which is again either the $20,000 or the $16,000. Hope that's clear. We are now at the question phase, and of course, I just have a quirky little statement here to get people laughing that mitochondrial replacement therapy, because even your cells deserve a strong maternal figure. Again, remember that nucleus would retain 99% of your DNA with only 1% that of a donor. Now, please share your questions if you have any. Of course, yes. Should you choose to proceed with us, we would absolutely give you a Tirana welcome guide that would have the clinic's information on there. It would also have the name and phone number for the woman with whom you're going to be in direct communication, who's actually on the ground in Tirana, who is employed by us. So she is wonderful. It will list hotels and restaurants, and all of that is on that welcome guide for you. Age limit. So the requirements would be that someone needs to have an AMH or an anti-Müllerian hormone level of above 0.00. And we're typically working with women. So those who are in the advanced maternal age category, the majority are between 39 and 52. Right now, the oldest patient who carried the pregnancy herself was 48 when she had the transfer and 49 when she gave birth. So great question about the age limit. So it just needs to continue. The woman still needs to have a period. Email details, of course, I would be delighted to send that. I can actually put that here in the message. So please feel free to reach out to me directly. Retrieval of eggs. Thank you for that question. We only accept M2 or mature eggs. So certainly if you retrieve GVs, those would be discarded. I can't speak to whether it would be recommended if you have a lot of GVs if you have a lot of immature follicles before you retrieve, if they could do a duostim and try to continue maturing those prior to the retrieval. But if they do retrieve GVs, those would be discarded. M1s would be retained and they would try to mature M1s to M2s. And then the M2s would be retained for the MRT process or zygote creation. So that's a good question as well. So for those who don't know that, we're talking about the quality of eggs. Immature eggs are GVs. Also, M1s is sort of between immature and mature, and then M2s are the matures. You have zygotes that are frozen. If you have zygotes that have been frozen less than 18 hours, yes, we can take them. We do have freezing instructions, and those instructions are between 14 to 18 hours post-fertilization. So once that happens, that's when we can work with the zygotes. If it is beyond that, which many people have embryos beyond that, unfortunately, is too late. Now, if you have eggs or oocytes in storage, that's a different story, and we could absolutely work with you on that. Okay. Do we take mosaics? When you work with us, we don't take them to manipulate them, if that's what you're asking, because again, it would be too far if you've already done PGT testing. However, if you do PGT testing with us after the MRT program, we do transfer euploids, and we would consider mosaics at that point with an additional consent signed from you. Um, Postmenopausal. Unfortunately, once the period has stopped, and if it has stopped for more than, I think, 6 months, it will be impossible for us to be able to help you because that means that the ovaries will no longer be producing eggs. Now, if you haven't had a period because you have some sort of anatomical issue with your body that you don't have a regular period, certainly we would want to know your hormone level. So we would want to know your AMH level. We would want to know your FSH level, and we would want to know your AFC or your antral follicle count, which is determined by an ultrasound. Okay, that would help us determine whether you would still qualify. AMH is anything above 0.00 is taken on a case-by-case basis. I'm going to type that in. Okay, let's see here. Data about this. We do have an informed consent document that does talk about heteroplasmy and the risk of heteroplasmy. So certainly I can send that to you if you would like, Miss Victoria. Please just drop me an email and I can follow up with you that way. Let's see here. If you have a couple of MRT embryos. Yes, so you can certainly determine which of the euploid embryos, if you have them done after MRT, you can choose which one you would like to transfer. Anytime you have PGT testing done, you will be able to determine what the gender is of that particular embryo, and you can make a decision that way as well, if that's important to you. I do not know about the robotic surrogate mother, so I'm sorry I cannot speak to that. Forgive me. After MRT. Oh, absolutely. Yes, you can store those embryos for as long as you wish. So there is a year of storage, cryopreservation and storage included in the cost of the MRT. So anything beyond that is super affordable to extend. I think it's like $300 to $400 a year. So, compared to other countries, it's significantly more affordable. Mini IVF. That is a great question, and that is a clinical question for Dr. Uliana. Should any of you choose to proceed, please email me and I can send you the patient form that needs to be filled out. And from there, we could schedule a consult with Dr. Uliana to review that. And then she could speak to you about the mini IVF or normal stimulation. I can tell you that in certain situations, when applicable, she does also consider the option of the duostem. After you freeze eggs or zygotes, does Dr. Leona provide transfer protocol? So after you transition to the support team, her clinical team will take care of you. So they will be in touch with you directly via WhatsApp. The reason is the end-to-end encryption, right? So they want to make sure that your information is protected. So they will be instructing you as to which medications to start and when. They don't typically give you that stereotypical calendar of treatment in advance because they really want to go on your parameters and start from where your body needs to go. And so then they send you for monitoring, of course, which would be ultrasound and blood work, and they would alter your medications based on the outcomes and how your body's responding. Sure. Annette, please email me and I will do the best I can to get you the recording. Miss Adriana, can you explain the challenges with shipping donor sperm? So I have had some clients who've been having issues with shipping to Albania. According to the Barol, the embryologist, it shouldn't be a problem. So Albania does not have a strict guideline as to whether they can only take anonymous or known donor sperm, to my knowledge. And so I think that that might be a misconception here in the United States at some of the sperm banks. We have been working with the European Sperm Bank, which is in Denmark. And so they haven't been having any problems shipping to us. So if that's helpful to you in any way. And then, of course, our sister company is Ovagene, and we also have donor sperm through Ovagene if you need ways to get around that. However, please just email me and we can continue from there if you wish. Miss Emma, pregnancy rate. We have a clinical pregnancy rate of 54 to 56%. So hopefully that answers your question. Again, we've had 32 live births so far. We have many pregnancies and we've done over 80 transfers in the last 2 to 3 years. Do we take eggs that were immature at retrieval? So I think I answered that question, so I'm going to skip that one. Follicular and genesis activation. Ms. Perez, I'm going to ask you to please look that up, the follicular genesis activation. That's a great question, but it would be about making sure that we're stimulating the ovaries in older patients. Stimulation, omnitrope. In some cases, the clinical team does prescribe omnitrope. We are the agency, so we're not the providers, but the providers sometimes do prescribe omnitrope. It is not available for purchase in Albania, unfortunately. It's like the one medication that is not, so you would purchase that in your home country if it is recommended. Success rates by age group, we do not have that. We've had only over 80 transfers now, so let's say 80 to 90. So it's not necessarily statistically relevant, but we are talking about the success rates for the entire group. So it's predominantly between 39 and 52. Okay, so when I talk about the 54 to 56% clinical success rate is exclusively in that category. We're looking at, let me pull that up so that that's helpful for you. Well, email me, please, and I will send you the statistics. Let's go there. Embryo freeze, that's included in the MRT price if you do it with us. I can't speak to any other clinics. In terms of egg donor matching, we choose the egg donor for you. And the reason is we want to make sure, again, our sister company is Ovagene. So they're the second largest egg bank in the world. We want to make sure that the donor matches a variety of characteristics. So one, the donor is healthy. Two, the donor has proven fertility of her own, which means she has children of her own already. Three, that donor has created children using her eggs through egg donation as well. And four, she is reliable and she will show up at our clinic. So we use fresh donor eggs. And again, it's only 1% of the DNA. So that's why we want to make sure that we are choosing the best donors and we know how they perform and how many blastocysts are created and things like that from their donor eggs. Upcoming dates. Dr. Uliana and Dr. Barul go to Tirana once a month. And so once you decide to proceed with us, we will let you know what those dates are, so that you can organize your calendar accordingly. Please, if you are a woman of advanced maternal age, please do not take traditional birth control. Please. It will suppress your ovaries, which is the opposite effect of what we want to do. So Dr. Uliana, if you choose to proceed with us, will probably put you on some progesterone to control your cycle if you want to be in Tirana during certain dates when she's there, for example. Otherwise, if she is not there, we work with Dr. Anissa, who's on the ground, who's also wonderful and has been trained by Dr. Uliana. So she will also assist with any retrievals if you choose to do them, and Dr. Uliana is not there. Sperm banks, I think I mentioned that. For any other specifics, you guys, I'm going to ask you to please message me and I'd be delighted to help you. It all depends on the number of egg retrievals, just depends on how many you're able to produce in each retrieval. Again, ideally you want to have a minimum of 4 to 6. So the ideal minimum is 4 to 6. If you say, you know, the actual ideal number would be closer to 10. Again, it all depends on you and your body and how many you're able to produce, because we know it's tough at this age. Okay. So forgive me, for those who want to learn about ovarian rejuvenation, and the idea for ovarian rejuvenation is that perhaps you would need less retrievals on the front end if you're able to mature the follicles that you have and obtain more mature follicles, excuse me, oocytes in each retrieval. And so that's the goal of this. And again, Dr. Juliana is the expert on ovarian health, and that's the next section that I'm going to go to. So for those who want to drop off, feel free to drop off. Feel free to send me a message. I would be delighted to work with you. And for those who want to stay, please do. I promise I'll only take up maybe 5 more minutes of your time. So ovarian rejuvenation, the goal is to awaken dormant follicles, increase the retrievable eggs, and enhance the hormonal environment for better IVF outcomes. Okay. So it's typically used for women with low ovarian reserve, poor stimulation response, or advanced maternal age. Oftentimes, in the majority of countries, I would say that PRP is the ovarian rejuvenation of choice. It is offered very widely and considered, a pretty well-used standard of practice. PRP, which is known as platelet-rich plasma, is done by drawing your blood, spinning it in a centrifuge, and then retaining the plasma and injecting it into the ovaries. For some women, it works, and they find that it works for them immediately, and it's helping right away. For other women, it doesn't do anything for them. So we offer an enriched program that goes beyond just the PRP. So PRP you can do local to you, but if you want it to be enriched and have a stronger effect, you could potentially do it through us and our partner clinic in Albania. So we offer PRP and exosomes. I'm going to explain what the exosomes are. So first of all, exosomes are purchased from an FDA approved, for those of you in the US, you know what I mean, an FDA approved stem cell bank in Turkey. It's called Stem Bio. So if you'd wish to look that up, I would urge you to please do that. The stem cells are housed in umbilical cords, and that's what they get. And exosomes are actually derived from the stem cells. So they're the proteins or liquid that is removed from the stem cells. So I just want to be clear, it's not cellular structures themselves. So you don't run the risk of your body rejecting it like you may reject an organ transplant, for example. It's not that. It's just the proteins in a solution. They come to us in a vial, and we mix that with your plasma, just like I showed on the other page, and then we'll inject that into your ovaries. We can also inject it into the endometrium if there's any endometrial issues as well. So that is something to consider. Usually, Dr. Uliana recommends this as a first step. Certainly, it would depend on you and your body and what you've had done before as to whether she would recommend that for you. But the reason is that they respond faster. So if I'm speaking with a lot of women of advanced maternal age, again, like I am, our ovaries are the first organs to go in our body. So that being said, we're kind of racing against the clock. We want something to respond quickly because the longer an effect takes, the longer we have for our ovaries to decline. So the PRP and exosomes typically respond in your body between 1 and 3 menstrual cycles is when you'll notice those effects. And Dr. Uliana would send you for ultrasounds or scans to check to see how your ovaries are responding to that, ideally in 10 to 14 days for her to see that. And then she would tell you when to stimulate. In terms of cost for this procedure, this is on the lower end. So it's $2,770. So it's just under 3,000 US dollars. Okay. The next one would be the Adinizer procedure. which you may consider as option number two. Or if Dr. Uliana knows you've tried PRP and it hasn't worked for you, she might recommend you go right to Adinizer. So the Adinizer is using your own stem cells. So what we do is we fly in a plastic surgeon who will do like basically a liposuction in your abdominal region and pull out the fat cells from your adipose tissue. And then what they would do is re-inject those fat cells into your ovaries because your fat cells actually have stem cells that are from your body inside of them. So it's just using those stem cells from your own body in your ovaries. Um, Typically, the effect of any stem cells, whether you use your own, which is this procedure, or a donor stem cell, which we're not offering at this time, takes up to 6 menstrual cycles for it to take an effect. So that's why she would often recommend the one that responds early, faster rather than this one. This could be the next step if you're not getting the ideal results or if it starts to wear off. So things to consider. You cannot actually, and I get asked this a lot, so I want to be super clear. You do not want to inject both the PRP and exosomes as well as the adenizer stem cells at the same time. And the reason is you could overwhelm your ovaries and shut them down, which would, of course, be the opposite effect of what you're trying to do. So something to note. In terms of the cost, it is slightly higher than the less than $3,000 we mentioned before. It would start closer to $4,600. And that would be just for the ovaries. And of course, you could add on their ovaries and endometrium or ovaries and endometrium and vaginal area, and it would all go up from there. So there are multiple options for that. So I'm going to come back to the Q&A and ovarian rejuvenation because sometimes even the ovaries need a spa day. So just a little quip there. Okay, so coming back to the questions. I think I answered the cost questions about PRP. Human cloning, we are not working on right now. I did speak with a lovely human who did do human cloning. His name is Dr. Samuel Wood. He's with Gen 5. Please look him up if you have not heard of him. He could answer questions about that. Any other questions about the ovarian rejuvenation or the MRT? Before we end the call, I just want to outline the next steps. It would be to fill out a really basic patient form about your needs in your body, and then scheduling a consultation for free with Dr. Uliana would be that next step. And then we would finalize your procedure. Once we finalize the procedure and we receive the 30% non-refundable deposit, so if you're paying $20,000 for the MRT, the non-refundable deposit, excuse me, would be $6,000. So something to keep in mind. Then you would meet your support team after that. And so you'd be connected to them and start communicating right away via WhatsApp. Okay. Any other questions or anything I can do for you? About the cost, is it correct that 3 egg collections with MRT? So I think it would be about, Joanna, like if you want to schedule a call with me to go over that, we can absolutely do that. If you shoot me an email, I can go over it with you. But it's going to take me a minute to do the math in my head. So I want to make sure that I'm giving you the correct answers. I'm going to give you my email again so that you have that. Correct. It's not a correlation between PRP and live birth. The correlation is between PRP and obtaining mature eggs. That's the idea. Especially if you're going to be manipulating the eggs, you're only going to want to pay for one MRT procedure. So the idea is to obtain more mature eggs in each retrieval. So you have to undergo less retrievals for some women. And again, PRP has mixed reviews, so it may or may not be of assistance to you. That's why we always recommend the exosomes if possible. Link to recording. Okay. Any other questions? Otherwise, I'll look forward to hearing from you all. Thank you for making the time. Have a wonderful upcoming weekend, and I trust you will make the best decision, whatever that means for your family. So take care.